Let me ask you something. Have you ever considered that a serious health issue could be developing inside you, or maybe someone you care about, without a single obvious warning sign? Well, there is one, and frankly, it's growing at a really alarming rate, often completely in the dark, until it's become dangerously advanced. Today, we're going to pull back the curtain on a true silent epidemic that's affecting millions and millions of Americans.
And I really want you to think about this question. You know, your liver is one of the most incredible organs in your body. It's a workhorse, it's resilient, it can even repair itself. But it does have its limits. And for millions of people, that limit is being pushed, and their liver is struggling, all without them ever feeling a thing.
Just look at this number for a second. 1 in 3. 1 in 3 American adults. As a doctor, I can tell you this isn't just a statistic to me. I see the reality of this every single day in my practice. We're talking about over 100 million people who are walking around right now with a condition called non-alcoholic fatty liver disease, or NAFLD for short. And what's truly staggering, according to a recent report from the American Liver Foundation, is that the vast majority of them have absolutely no clue. And this goes way beyond just an individual health problem. This is a massive public health crisis. Think about that number, $100 billion. That's the annual cost to our healthcare system. So in this explainer, we're going to do a deep dive. We're going to break down exactly what NAFLD is, figure out who is most at risk, and, this is the most important part, we'll look at what the latest science says you can do to fight back and even reverse the damage. So here's our game plan. We'll kick things off by really grasping the scale of this silent crisis. Then, we'll get into the weeds of what the disease actually is. From there, we'll explore the specific risk factors so you can see where you might stand. After that, we get to the good news, the powerful, proven strategies for reversing the damage. And finally, we'll wrap it all up with a clear, straightforward action plan you can start using today. All right, so let's jump right in. The scope of this problem is huge, and its silence is exactly what makes it so incredibly widespread and, honestly, so dangerous. You know, according to the National Institutes of Health, NAFLD has officially overtaken conditions like hepatitis C to become the #1 cause of chronic liver disease in the entire country. And get this, a recent study pointed out that a mind-boggling 60% of cases are found completely by accident. Somebody goes in for a routine checkup for something totally unrelated and boom, there it is. That tells you there's a massive gap in how we diagnose this. And this is absolutely crucial to understand. This is not just about your liver. The effects of this condition ripple throughout your entire body. For instance, having NAFLD increases your risk of heart disease by a whopping 50%. It literally doubles your risk of developing type 2 diabetes. And for 3 to 5% of patients, it will eventually progress to life-threatening cirrhosis or even liver cancer. So you see, it's a systemic problem that we have to take seriously. So, knowing all those risks, let's zoom in a little bit. What is actually happening inside the body when a doctor says someone has a fatty liver? What does that even mean? Well, the clinical definition is pretty straightforward. It just means that fat makes up more than 5% of your liver's total weight, and, this is key, it's not being caused by heavy drinking. But it's not just one thing. It really exists on a spectrum. The early stage is what we call simple fatty liver, or steatosis. That's just excess fat. But when inflammation and actual liver cell damage enter the picture, it morphs into a much more serious condition called non-alcoholic steatohepatitis, or NASH. This timeline here shows you exactly how that progression can happen. It all starts quietly, with that simple fat buildup. If that's left unaddressed, it can progress to NASH, where the liver is now actively inflamed and under attack. From there, the liver, in its attempt to heal, starts forming scar tissue. That stage is called fibrosis. This is really your liver's cry for help. But if the injury keeps happening, that scarring can become severe, permanent, and irreversible. And that is cirrhosis, a condition that dramatically raises your risk for liver failure and cancer. But here's the crucial takeaway. The early stages are absolutely reversible. Okay, this brings us to probably the most personal part of our conversation. Who gets this disease? Let's take a look at the data, because this is where you can start to assess your own personal risk factors. The risk factors really fall into two main categories. Over on the left, you see the modifiable ones. These are the things that we can actually influence. Things like obesity, a diet that's high in sugar and processed foods, and not moving enough are huge drivers. Other conditions like type 2 diabetes and high cholesterol are also very closely linked. Then, on the right, we have the factors we can't change.
Our genetics, our age, the risk goes up after 40, and even our ethnicity.
And ethnicity really does play a significant role here. As the research clearly shows, Hispanic Americans have the highest prevalence of NAFLD at 45%. Part of the reason for this seems to be a higher frequency of certain genetic risk factors, like a specific gene variant called PNPLA3, which is more common in some populations.
And this quote from Dr. Mary Ranella, who is one of the leading liver specialists in the country, just sums it up perfectly. She says, lifestyle is the biggest driver, but genetics and environment play roles. The key part is that last sentence. Understanding these risks empowers you to act. This isn't about blame. It's about knowledge. It's about giving you the information you need to take back control.
Okay, we've covered some pretty serious information. I know. But this next section is, in my opinion, the most important part of this whole discussion. This is where we pivot from the problem to the solution. We're going to talk about hope, and we're going to talk about action. Because the truly fantastic news here is that NAFLD is both preventable and, in many, many cases, completely reversible. Look at this number, 50%. This comes from a landmark study which found that losing just 10% of your body weight can slash the fat in your liver by up to 50%. Let that sink in for a moment. Just a 10% weight loss can cut liver fat in half. It just goes to show you your body has this amazing, incredible capacity to heal itself if you just give it the right tools.
So what are those tools? Well, the research is crystal clear. It all comes down to these 5 core strategies. And these aren't just fads or quick fixes. These are the evidence-based, scientific pillars of liver health. Let's really break down the 2 that have the biggest impact of all, diet and exercise.
Study after study shows that a Mediterranean-style diet, one that's rich in vegetables, whole grains, healthy fats, and lean proteins, can reduce liver fat by 20% on its own. Now, why does it work so well? Well, it's packed with antioxidants and things like omega-3 fatty acids, which actively fight the inflammation that's driving the liver damage. And it doesn't have to be complicated or expensive. A simple meal like this is perfect. But the single most important guideline, keep your added sugars under 25 grams a day. That is a game changer. Next up is movement. And look, you do not need to become a marathon runner or a bodybuilder. The goal is simply 150 minutes of moderate activity per week. That breaks down to just a little over 20 minutes a day. And it turns out that even something as simple as brisk walking, which is free, can reduce liver fat by 15%. This is accessible to almost everybody, whether you're walking in a park or just following along with a workout video in your living room. So, we've talked about the problem, we've talked about the causes, and we've talked about the solutions. Now let's bring it all home and forge this into a concrete, manageable plan that you can put into action the minute we're done here. First things first, knowledge is power. If you have any of the risk factors we talked about, please talk to your doctor about screening. It usually starts with very simple blood tests to check your liver enzymes. From there, you might get an imaging test like an ultrasound or a special test called a FibroScan. These are standard, non-invasive procedures, and they give you and your doctor a crystal clear picture of your liver's health. Knowing your numbers is always the first step. And please remember this, you do not have to do this alone. Building a support system is absolutely critical for success. This could be professional help from a dietitian, or maybe free community programs at your local YMCA. There's even financial assistance for healthy food through SNAP, and incredible online support groups. Having people in your corner can make all the difference in the world. So, how do we put this all into practice starting now? I want to leave you with something simple but incredibly powerful. Let's call it the 30-day liver health challenge. For just the next month, I want you to focus on only 3 things. 1, adopt a Mediterranean-style diet. 2, walk for 30 minutes every single day. And 3, make the call to schedule a checkup with your doctor. That's it. It is a powerful, powerful start. Because ultimately, this all comes down to you. This is your liver, and this is your life. You now have the information, you understand the risks, and you know you have the power to make a real change. So I will leave you with this one question. After hearing all of this, what is the one small step you will commit to taking starting today for your own health?